The Lao PDR will extend maternity leave from 3 to 6 months to provide the best conditions for an exclusive breastfeeding. The plan was scheduled at the technical meeting on extending maternity leave for better child survival and nutrition. Dr. Khamseng Philavong, who is responsible for nutrition work of the Ministry of Public Health, told the gathering that exclusive breastfeeding from the very beginning is identified as one of the most effective interventions to reduce child mortality and improve nutritional status among young children.
Of milk through milk ducts. Breastfeeding benefits your baby by providing the optimal balance of nutrients, providing antibodies to support your baby's immune system.
The research points out to the role of breastfeeding in the development of baby's immune system and protection against infections. Breastfeeding is associated with the increase of IQ or intellectual coefficient scores and improved school performance.
Nurse as long as he or she wants. Many newborn babies nurse 8 to 12 times a day.
Dr. Khamseng Philavong said, "Mother will benefit as well since breastfeeding is associated with reduced risk of contracting type 2 diabetes and breast and ovarian cancer. Breastfeeding protects against health risk and high cost of formula feeding, providing health benefits. Breastfeeding saves time and reduces the cost of medical care for sick children." The Lao PDR has registered an important decline in infant and under 5 mortality and is on track for reaching the Millennium Development Goal 4. According to France Begin, representative of UNICEF, the neonatal condition, pneumonia and diarrhea are major child killers, and an estimated 1/3 of child deaths are attributed to undernutrition. A policy of breastfeeding improvement is an issue of maternity protection, since a large number of women stop breastfeeding because they have to return to work. The importance of maternity protection aims to protect health and safety of both mother and child. According to the representative of UNICEF, the global evidence shows that return to work early is one of the main reasons women give for not exclusively breastfeeding. A long-term and well-funded maternity leave encourages breastfeeding. For employers, stronger maternity leave policies create a more stable and loyal workforce. UNICEF believes that a new convention of global health policy on breastfeeding that includes 4 months of paid maternity leave and a new recommendation for the 6 months will bring an important normative function whenever countries will review their maternity protection legislation during the next half century. The extension plan of maternity leave to 6 months will be then forwarded to the government consideration. The meeting was attended by Head of Secretariat of the National Commission of Mother and Children, Jongchit Chantalanon, and General Direction of Personal Department of the Ministry of Home Affairs, Visay Pandanuvong.